us on the map. Mr. Caruana leading the beat. Australia global rank 6. Feeling the heat like immortality.
All right, so in today's video, we are looking at the concept of complementary healthcare. So a complementary healthcare approach is meant to work alongside or in tandem with traditional primary care to enhance the health outcomes of the patient. So when I'm talking about complementary healthcare, what am I really referring to here? Things like this, acupuncture, aromatherapy, Chinese medicine, osteopathy, chiropractor, okay? These are things that you can do that many people do go to get better, to treat symptoms, okay? To enhance their health outcomes, all right? They should not be used in the context of this section of the video. They should not be used as an alternative to primary care, all right? For example, I have done something in my lower back and my lower back hurts and I can't bend over and I can't tie my shoelaces and stuff like that, all right? What should I do? Well, I should go to a doctor, okay? Alongside going and seeing the doctor, and doctor may send me for some scans, maybe an MRI, might send me to a physiotherapy, which is primary care. But alongside that, I may also want to maybe go to a chiropractor. I may want to get some acupuncture, okay? Or maybe you go and see an osteopath. Those things are meant to, hopefully, they could actually fix my issue, all right? But they could also just enhance my outcomes and make me feel better about the fact that I'm actively doing something to help my lower back. And then the scan could come back from the MRI and the doctor, and the scan to say, oh, there's nothing wrong, okay? Well, the scan says there's nothing majorly medically wrong, but I'm still in pain, and then I go and see one of these guys and they fix my pain. Well, that has worked well together. As opposed to not going and seeing the complementary people, I just go to primary care, I have a lower back issue, the doctor sends me for all the scans and tests and says there's nothing wrong with you, you're just a whinger, basically. Not that the doctor would say that, but that's what they're thinking. I know they are. So this is why we use things like this as a complement, all right, but not alternative, all right? Because, okay, let's go the opposite route. Let's say once again, I've injured my lower back, I can't tie my shoelaces, I'm in lots of pain, etc., and I just completely skip the doctor, and I go to a chiropractor, and they do an adjustment, and it could make it worse, okay, depending on what the issue is. And then I'm like, and now I can't move, let alone, tie my shoelaces. And then the chiropractor's like, oh, maybe you should go get a scan. So then I go and see the doctor, and then I, find out I've got like 3 slip discs and whatever, okay? Because I didn't use it complementary, I used it as an alternative service, I didn't get an actual accurate reading on what was medically going on there. So that's why we use them in a complementary or in tandem with primary healthcare to enhance outcomes. Now, complementary health services are increasing in popularity, and they have been steadily increasing for the last 15, 20 years, all right? There are multiple reasons for this. First of all, multicultural society in Australia. We have lots of different people from all around the world that make Australia a very multicultural domain, and therefore we have lots of services because people bring their skills and expertise to our country and therefore deliver them. Alongside that, we've got recognition and coverage by private health insurance. So if you do hold private health insurance and you take out an extras policy, a lot of the time that extras policy will have allowances for, going and see a chiropractor or osteopath or Chinese medicine or any of these, and I'll give you a bigger list later, okay? So you can go and see them, and then the private health insurance gives you money back, all right? So they're recognizing that, well, there's actually probably something to this, and if it helps the health and well-being of the patient, then we are happy to support that. And then finally, alongside the support, we've got tertiary education and university degrees on delivering these services, okay? So, back in the day, you would just go and see like the local acupuncture person, and, they may have had like 40, 50 years experience, but they didn't actually have a degree in, for a lot of people, that is a major, red flag. But nowadays you can go to university and you can get a bachelor's degree in like Chinese herbal medicine, or you can get a bachelor's degree in chiropractic or osteopathy, all right? So education is recognizing that these are legitimate services for people, and therefore we can qualify them as such. And then, people who are qualified get held to standards and, got to go through that accreditation process. So the service you are getting is legitimate, and that it is backed by research and education, and therefore supported with private health insurance, and you're good to go, okay? So that's our general intro into what complementary healthcare is. Now we will go into the syllabus points. Right, so now we're going to go through a range of products and services which are deemed as complementary healthcare. There are way more than this, okay? I've probably given you way too many here, but there have been times in the past in the HSC where they've asked multiple choice questions about really nuanced ones, like Bowen therapy. It was like a multiple choice question in like 2012 or 2013 or something. And all the people that didn't cover Bowen therapy, they got, stitched up. So I've tried to give you a wide range here of things that you may get asked on, or at least you've got good examples to use in your written responses. So let's go. Acupuncture, okay? Acupuncture, fine needles, like really long, really thin needles. They get inserted under the skin. They're meant to hit certain nervous or pressure points in the body to stimulate energy flow, okay? Which therefore relieves pain and promotes healing, okay? I have had acupuncture done many, many times. It's an interesting feeling, okay? I wouldn't say it's a nice feeling. I'll tell you what is not nice about it. Okay. It's not a nice feeling, right? So you're laying on a bed and then the lady who I was seeing, just puts you all these long needles in you and then leaves you in the room for like 20, 30 minutes, okay? Now, while it's not a nice feeling, it used to cause such relaxation that I would fall asleep, okay? That's a bad thing because as I'm laying there on the table falling asleep, when you fall asleep and then like you shock yourself awake and you're like, oh, I shouldn't be asleep right now. Well, I would do that, but because when you shock yourself awake, you contract all your muscles and your muscles have long needles in them, it hurts a lot. So yeah, that's my acupuncture story. Good times. Aromatherapy. Aromatherapy uses essential oils, either used in a scented format, so you can just smell them. People put them on like tissues or handkerchiefs and put them in their pockets. You can put them in a diffuser. You could put it in a bathtub and then the steam would do it. Or you can apply it directly to the skin, like people put them on their temples or under their wrist here, etc. So the scent itself is what we're targeting here. The scent or the smell is meant to improve emotional and physical well-being, okay? There are certain scents that produce certain responses in the body. Hence, you've got to use the right oil for the right situation. But people that use aromatherapy swear by it, all right? Same as people that use acupuncture, swear by it, okay? Not saying any of these are good or bad. There are people who have had excellent success with all of these methods and some people that get nothing out of it. And that's fine because you're meant to be using them complementary to actually getting primary care from a doctor anyway. Bowen therapy, all right? Bowen therapy is like manipulation of the body to treat musculoskeletal conditions and stress. Okay, it's very similar to osteopathy, which we'll get to in a minute. Chiropractic. Haven't had Bowen therapy, for the record. Chiropractic aligns the spine and nervous system to improve nerve signaling, reduce tension, and alleviate pain, all right? Chiropractic is one of those things that is definitely rapidly increasing in popularity to the point where I could actually see this being eliminated from complementary healthcare and go into primary healthcare in the next 10 or 15 years, all right? There's like, have you seen the videos on YouTube, chiropractic? Very satisfying to watch, all the cracks. I don't know where they find these people, but they have just like the biggest cracks. Anyway, it's good times. And now chiropractic even is expanding from just spine manipulation, so they will manipulate the other joints of the body to put the joints back in line and therefore promote good nervous system signaling. Now, chiropractic, this is actually one of the things that I personally enjoy and I swear by. So I do have a lower back. I have a slip disc. I think it's my L2, I'm going to say, is out of alignment. Because that disc is out of alignment, it pushes on my spinal cord and it gives me great radiating pain down my body, okay? And to the point where I can't bend forward or bend back, etc. Now I went to a doctor because I actually couldn't, the first time it happened when I popped it out the first time, I couldn't move. Like as in like I could move, but it was like, I felt like I was dying, like I was like 22, right? But it was bad. And I was young, like 22 is pretty young. I still remember, went to the doctor sent me for scans. sent me to a physio, okay? Went to a physio regularly for, I don't know, a good 2-3 months, maybe twice a week. And yeah, it was getting better, but obviously naturally over time you start healing. Obviously within a few days I could move again. I wasn't off work or anything. But it was still there. The pain was still there. Like we're talking months down the track. And I went back to the doctor, sent me for another scan, and that scan said that everything's fine. Your pain is just residual, or it's your nervous system thinking there's still pain there, and your brain does weird things. And then I went and saw a chiropractor because I was like, well, I've been to a physio, I've been to a GP, nothing's really going. Chiropractor, boom, pain gone. One session, pain gone. Now, like I said, this is like some weird voodoo magic or whatever, but it worked for me, okay? Now, I regularly go and get a chiropractic alignment just to keep things in check, and touch wood, I don't have lower back problems anymore. That's my story. Herbalism, so this is like Chinese traditional medicine or other forms of herbalism, uses of plants and herbs to create medicine, support and heal the body. So when we were trying to, I've got a story about all these, when we were trying, except on therapy, trying to have children, we were having some difficulties with that process. And my wife wanted to try herbalism because she'd heard good things about using Chinese traditional medicine to promote fertility. And I would be there at nighttime cooking up this like a black sludge, like seriously disgusting. There was like 7 different brown paper bags, and I had to put like a cup of this one in and a teaspoon of this. It was, and then like boil it on the thing for 15 minutes and then cool it down into like this sludgy black liquid. And then Liz would drink it. And I tasted it just one time, just so, you know, we're in it together. It was disgusting. Like it was pretty much drinking dirt, like bad dirt. But she did it, and we had children. So I'm not saying that herbalism or Chinese herbal medicine worked, but it certainly didn't work. It didn't not work, as in she didn't have it and we still didn't fall pregnant. She did have it and we did get pregnant. So who knows? Who knows? Homeopathy, haven't had homeopathy. So microdosing of herbs and medicines to treat illnesses, and this is a little bit different because it's like cures, like response. It's sort of like getting a vaccination, all right? So if you want to get immunized or vaccinated against certain strains of the flu, they give you like a deactivated version of that flu in your system. Your body builds up an immune response to it, and therefore when you actually encounter the flu in the wild, you don't get sick. Homeopathy is a bit the same, all right? You get microdosed with herbs and medicines that are actually meant to be bad for you. But because it's such a microdose, your body develops a tolerance to it, and therefore when you encounter the thing in the wild, you don't get sick. Naturopathy, so use of mainly minerals and herbs, I put vitamins up there too, to achieve balance and promote self-healing, okay? So you might be like stressed, or you might have skin issues, or nail issues, or just any sort of issue in your body. You go and see a naturopath, and they'll do like a full analysis, and they'll probably do some iridology. Oh, iridology, I should add that on here. Iridology, which is like they examine your eyes and your pupils, and they can tell all this amazing stuff about your whole body from your eyes. Iridology. Anyway, back to naturopathy. And they'll be like, oh yeah, a lot of your issues is probably from low magnesium and calcium. And then they'll give you like a mixture, whether they compound it themselves or whether they have products available to treat those issues, okay? Osteopathy. I don't like osteopathy. I'll get to it in a minute. So body manipulation to realign skeleton and muscles to reduce tension and pain, okay? Now, my wife swears by osteopathy on the very rare occasion that she does have musculoskeletal issues. So if she's got tension in her body or her, legs or arms or back or whatever, she goes and sees the osteopath and she feels better. I have been to an osteopath 3 times, and each time I have not felt better. I haven't felt better straight away. I haven't felt better later that week. Okay, I've ended up going and referring myself back to either physiotherapy or chiropractic or something, which then I do feel better. Okay, osteopath doesn't work for me. Works for thousands or millions of Australians though. So you do you. Now, lastly, an interesting inclusion on the list, wearable technology, okay? Smartwatches and all those types of things, okay? Because if a complementary healthcare approach is something that's meant to work alongside you getting treatment for illness, then we can use watches and things to promote step counts or track our workouts or encourage you, or you've been sitting down for an hour, you need to get up, stand and stretch. Well, all of those things are going to reduce cardiovascular disease and, effects of insulin and diabetes. So why not throw it on the list? So that's a range of products and services. Okay, so how can we use complementary healthcare for prevention, all right? So instead of using it alongside our GP when we're sick, we could be using complementary healthcare approaches all the time to prevent us getting sick in the first place and seeing the GP. So because therapies emphasize active aging, lifestyle modifications, and good nutrition, they can be used to actively mitigate disease and illness, okay? So I gave the example previously about the chiropractor. So while I, touch wood, don't have lower back issues currently, that's not going to stop me going and seeing the chiropractor. I will go and see the chiropractor because in my experience with my own body, when I see the chiropractor regularly, I don't get lower back issues. It's only when I stop seeing them for X amount of time and then I do something dumb in the gym or at work or whatever that my lower back, kicks into overdrive and then I know about it. So an actual explicit example that you can write down. So there's an adult at risk of developing CVD, okay, could be a risk because of genetic factors, age, male, family history, all that kind of stuff, overweight, etc. They consult a naturopath, all right, because why not? The naturopath focuses on holistic health, such as diet modifications, herbal supplements, and giving them stress management techniques to reduce blood pressure and assist with weight loss, all right? So we're doing all these things to assist lowering blood pressure, lowering their maybe weight, etc. That will therefore directly enhance their well-being while subsequently lowering their risk of developing CVD. All right, so yes, they could go and see a GP. Let's say that they're morbidly obese, all right, and the GP gives them lap band surgery. Well, they could do that. That's a primary care method. But then at the same time, we can do all these other things which also help mitigate the risk, all right? But you could go and see a naturopath anyway, all right, and do some things to help you. Interesting fact, here's a fun little experiment for you. I'm not advocating for naturopaths here, by the way. This isn't an ad or anything, and I don't see a naturopath. I have seen one, have seen many in the past, but haven't seen one in like 15 years. But it'd be interesting if you all went and saw a naturopath and just get an assessment, okay? Because I know a lot of you are stressed or tired or whatever. It'd be interesting to go through that with the naturopath and see what they find out, okay? Maybe you do have a mineral imbalance, or maybe you are eating something that is triggering some sort of inflammatory response in your body. It'd be interesting. You should do it and report back. Anyway, that's for prevention. All right. Using complementary health services for treating health issues, okay? So the WHO, World Health Organization, they make a recommendation, all right? They recommend that using complementary health services should be used appropriately, effectively, and safely based on the latest scientific research, and that complementary services should never replace conventional treatment, all right? There are too many people in the world who will get diagnosed with, cancer or CVD or something, and instead of getting traditional therapy like chemotherapy or whatever, they'll be like, oh, you know what, I'm just going to try bone therapy for 6 months and see how that goes. And then unfortunately they die. Well, that took a turn. There's nothing wrong with bone therapy. I'm not hassling bone therapy here. What I am, I'm hassling the consumer, because being a critical health consumer and having good levels of health literacy should enable them to see, hey, you know what? My doctor's recommending we start chemo next week. Let's do that, and I'll do bone therapy, okay? Do both. That's what a complementary service is all about. So my example, a woman diagnosed with lung cancer, because women have higher rates of lung cancer, anyway, scheduled to start chemotherapy, also uses herbal medicine and acupuncture. The use of herbal medicine and acupuncture does not delay or interfere with the chemotherapy treatments and may enhance her success in beating cancer, all right? This is a very positive story, and this happens every day. I'm not saying herbal medicine acupuncture helps beat cancer, but I am saying that the use of these services puts people in a better frame of mind, and it may actually, on a physiological level, help them beat cancer. So, you know what? I figured if you are, dealt a bad deal or a bad deck of cards, you should be trying, or personally, I would be trying everything I can to make it better. All right. So if I got, if this was me, then I would be throwing everything I could in the bucket to see whether we can, fix it. Anyway, that's my point of view, and I shouldn't be talking about that on the video. Anyway, whatever. Okay, so lastly we need to go through as a supplement to other medical treatments. Now I feel like I've already touched on this many times in the video, but there are some things that I did want to just clarify before we round out. So complementary healthcare is highly effective when used alongside traditional treatments. No one's saying it's not, okay? They're a good thing, all right? They're good for many benefits due to either the physiological effect on the body, so whether the actual chiropractor, acupuncture, aromatherapy, herbal medicine is actually doing something physiological to your energy systems or the way your nervous system works, etc. Or whether it's the mental placebo effect of healing, okay? That is, I am doing things to get better, therefore I get better, okay? There is such a strong connection between what your brain believes and what happens in the body. If you constantly think to yourself, I've got pain in my knee, I've got pain in my knee, oh, there's pain in my knee, well, guess what? You're going to have pain in your knee for a long time, all right? But if you are doing things to actively help the pain in the knee, the pain may go away. The brain is very, very powerful, all right? Now, the only caveat is that you should always, and patients should always consult their GP or their specialist first before starting complementary healthcare, because there are some very niche interactions with some complementary health approaches which actually interfere with traditional treatment, okay? For example, St. John's wort, which is a common herb used in many herbal medicine treatments for depression, anxiety, stuff like that, actually reduces the effectiveness of chemotherapy, all right? So chemotherapy drugs, which are quite nasty, make your hair fall out, etc., but also kill cancer, they need to sit in your system and in your bloodstream. If you have St. John's wort, it actually clears chemotherapy drugs out of your bloodstream. So therefore, your cancer treatment doesn't work. Interesting. But things like that, which is why you should always consult your GP and specialist. Or another example, which isn't a common example, thankfully, because people aren't this dumb, but there probably is somebody. Going and getting osteopathy, so manipulation of your leg and your knee and stuff, if you need an ACL reconstruction, okay, that's probably just going to snap it right off and make the treatment and the surgery even worse. So that would be dumb. So don't do that. So overall, that will round out and finish off our video on complementary healthcare. Thanks.